Hello, my name's Luke Munford and I'm a Senior Lecturer in Health Economics at the University of Manchester. I'm really sorry I can't be with you today at this really important event. It's crucial, I think, that we bring together colleagues in the community and voluntary sector, together with the people who work within the universities across Greater Manchester, but also the local authority and the decision makers and the combined authority that exists within Greater Manchester. So what I want to talk to you today about is something that isn't particularly good to see for people who live in the north and in Greater Manchester in particular. It's about some of these unfair health inequalities that have existed before the pandemic and unfortunately have been much worse during the pandemic. So let me just. So over the last few years, myself and colleagues at various universities across the north of England have been really trying to understand what we know about these health inequalities that exist, why they exist, what's been happening to them over time, and what we could possibly try and do to intervene to try and make this a bit better for people living in the north. Because I think the key thing is there is nothing right, there is nothing fair, and there's nothing just about these health inequalities. We don't need to live in a country where they exist. And there are things that national government can do to really help to empower local people and local organisations to try and really make a difference and combat some of these unfair inequalities that exist. So over the last 3 to 4 years, we've produced a number of different reports that have essentially looked at how people in the north, on average, do worse than people in the rest of the country, and how this isn't their fault. Essentially, this isn't due to what the people in the north of England are doing. These are long entrenched inequalities that have been left to continue to grow, and this problem has just exacerbated over many years, if not decades. So I'm going to focus mainly on the latest report we did, where we looked at what was happening during the pandemic and how people living in the north, particularly in Greater Manchester, got a bad deal out of the pandemic. But before we look at that, I think it's important to see what was happening before the pandemic, because we know that health inequalities have existed for a long time. And again, it is us northerners who tend to get the worst deal with respect to our health outcomes. So because of these inequalities that existed before the pandemic, we expected there's some differences to manifest during the pandemic, but the size of differences really are quite stark. But as I've said before the pandemic, we knew there was these unfair health inequalities. So if we just look at life expectancy, so that is essentially how long each newborn baby will expect to live on average in various areas. So here we just show this using the East Coast and West Coast train lines to basically try and emphasize this point that the further north you go on average, the worse people's life expectancy is, so the worse their health outcomes are. So essentially you can see Manchester in the northwest has really quite low life expectancies. And when we drill down into some more detail, so if we look at really small areas and see what the average life expectancy is, these top boxes here show the case for Manchester. And you can see that they're around about between 75 and 80 years, and that's up to 20 years fewer than some babies born in other parts of the country, particularly the affluent parts of London and the southeast. So there's these 20 years before the pandemic. In the extreme, there was 20 years difference in life expectancy. And when we look at averages, it was about 2 to 3 years between the north and the rest of England. That really isn't fair. Every child, every person born should have the same rights, the same ability to have a healthy, happy life, and being able to flourish in that life. And England is quite unique in Europe and when compared to the US and Australia, in that actually these health inequalities have been getting wider over time. So most of the countries are seeing health inequalities narrow. So for example, in Germany, after reunification, the East and West Germans now have very similar life expectancy, very similar health outcomes. But in that same time period, the life chances and the health of people in England, particularly the north against the south, has grown wider. And we can see here in the mid-2010s, this unprecedented, particularly before the pandemic, scenario where life expectancy actually fell, particularly for females and particularly in the north of England. That really is or was unheard of coming in to the pandemic. This has been really getting worse for quite a while now. Essentially, life expectancy is a really interesting measure of health. So it basically combines lots of information on areas, so the number of people being born and dying and what they're dying of. But if we look at all sorts of other different types of health outcomes, so the prevalence of preventable or non-communicable diseases, the prevalence of infectious diseases, essentially whatever we use to measure health, people in the north get a worse deal than people in the rest of England. And again, this is an average figure, so there are some places in the north that do quite well, and there are some parts of the south that do quite badly. But on average, people in the north have worse health than their compatriots living in the rest of the country. We can also look at economic outcomes. So people living in the north have fewer chances to get jobs. So this figure here on the left-hand side shows the number of jobs per person who's looking for a job. So essentially in the north, there are 79 jobs for every 100 people who would like a job. You compare that to London, there's 102 jobs for every 100 people who want a job. So you can see there's big disparities. So even people who want a job can't get it through no fault of their own. And this then comes out when we look at average wages. So average wages for both males and females are lower in the north than the rest of England, even when we exclude London from the rest of England, because London is a bit of an anomaly with quite high salaries. But even compared to the rest of England, excluding London, both males and females have lower wages in the north than the rest of the country. We've recently shown that this isn't due to people working shorter or fewer hours, and actually people in the north tend to work longer and harder than people in the rest of the country. But there's not the access to these really high paying jobs for people living in the north that there might be in London and the southeast. So we put all of this together. As economists, we're interested in this idea of productivity. So how many goods and services are produced within an area and how does that vary nationally? So you might have seen national figures about gross domestic product. At a smaller geographical level, we use a similar concept called gross value added, and essentially this allows us to compare different regions and different parts of England. So because of the types of jobs available to people in the north and their health being worse and not being able to stay actively engaged in the labour market for as long as they may wish, we can see that productivity is lower in the north than it is in the rest of England. And in 2017-2018, the size of this gap was estimated to be about £44 billion a year. And this isn't anyone in the north's fault. It's the circumstances that the people are born into, the fact that there hasn't been as much investment, there aren't as many jobs for people to do. This really is unfair. And again, they change over time. So things were already worse in the north and actually the level of growth was smaller. So this gap's just got bigger and bigger and bigger. And then in 2018, in a report we did, we tried to look at how does health contribute to this. So as I've said before, you could think of health allowing people to stay in the labour market, to continue working. We know that people in the north have to quit their jobs because their health, for health reasons, more than they do in different parts of the country. So if we can improve people's health in the north, if we can make someone born in Manchester as healthy as somebody born in London or the southeast, what would happen to the overall economic performance of the north of England and England as a whole? And what we found was actually quite surprising. So about a third, 30% of this productivity gap of £44 billion a year is directly caused through people in the north having poorer health, and again, through no fault of their own. So we argue that if you invest in people's health, if you get them healthy, if you make them feel better about themselves, they will be much more engaged people, they'll feel much happier, they will be able to work for longer, and there'll be substantial benefits to the local economy. And this money that we can save far, far outweighs the cost of improving people's health. in the north of England. So there are real fiscal economic arguments to improving people's health in the north. So we've shown that things were bad in the north before the pandemic, and that was unfortunately getting worse again before this pandemic hit. So what could possibly have caused that? So without being too political, one of the main causes that has been shown to be behind this is essentially austerity. So austerity was the coalition government of the 2010s decision and choices to take money away from local authorities to try and save money, if you like, from government expenditure. But we know it was precisely the areas with the highest need, the people whose health was worse, had the biggest cuts. So for example, if you look at Greater Manchester, parts of the North East, and the North as a whole, where health was worse before austerity, these were exactly the areas that were disproportionately hit. And this made things worse. So there's evidence now to show that these austerity cuts were really strongly predictive of the falls or the changes and the stolen life expectancy and within these old industrial parts of the north. If we just look at, for example, at the children living in poverty in 2010 and the cuts per head in the early part of austerity, so between 2010 and 2015, you can see the areas that had high levels of child poverty had the biggest cuts. So this is completely counterproductive. We're taking money away from the areas that has the highest need, has the highest scope to benefit from this investment, and we're not really taking it away from the areas that had decent or good or better health before austerity. And interestingly, if you split this by political party, essentially all or most of the areas that lost out were under Labour control, so the Labour councils. And again, this was the party that wasn't in government. So there is some, if not a lot, of justification to say this was very politically driven. You can see here Manchester had very high levels of child poverty, unfortunately, and had very high substantial amounts of money taken away from them that they could have then used to invest in improving child's health and the health of the wider population. So because of all of that, we did expect there to be regional differences in COVID-19, and we expected the north to be disproportionately affected, but we didn't expect the results that we found. We didn't expect these differences to be so pronounced. So this is just a map of the mortality rates for all causes in COVID and other causes, and you can see that the highest mortality rates were situated within the north of England, particularly within Greater Manchester and the 10 boroughs of GM. So the COVID-19 mortality rate, so the number of people who died, unfortunately, due to COVID-19 was 39.8 more deaths per 100,000, or 21% higher in the northwest. When we drill that down into specific parts of the northwest, we can see Greater Manchester had almost 40% more higher mortality than the English average, and these are huge increases. A similar picture when we look at deaths from all causes. So the northwest had 12% higher mortality than the English average. The Greater Manchester was about 17–18% higher than the English average as well. But when we look at by the various boroughs of Greater Manchester, there's huge increases. So Greater Manchester on average had 38% higher mortality than the English average, but in Manchester that was 59% higher. In Tameside and Salford it was 52% higher. In Oldham and Rochdale it was over 50% higher. So this is essentially, for every 2 people who died in the rest of the country, 3 people, or more than 3 people, were dying in Greater Manchester. These are massive increases. And again, this is true for all cause mortality as well. We've got up to 40% more people dying in Manchester than were dying in the rest of the country. These are unprecedentedly large numbers, and they really, really are unfair. So what we want to do, I'm not going into too much detail about this, is try and model what is it about living in the north that led to these worse COVID-19 outcomes. Was it the differences in the age structure, or was it crucially the differences in the prevalences of poverty and deprivation? And was it because people living in the north had worse health before the pandemic? And we argue that these two things here are potentially, or they are preventable. And if levelling up is to be taken seriously, these two things, so the population health and the prevalence of poverty and deprivation, have to be equalised across the country. We can't have the north, Greater Manchester, the various boroughs of Greater Manchester continually being left behind other parts of the country. So we estimate a series of models, and we essentially show that when we compare these two models here, about 51% of the additional mortality that was experienced in the north of England was potentially preventable. So when we try and put that into context, that's about 2,500 people who died that wouldn't have died if people in the north had the same life chances and the same levels of opportunities that people in the rest of the country had. When we look at all-cause mortality, it's even bigger. So 68% of the increased mortality we saw in the north of England was and should have been prevented. So essentially, when we scale that up, that's about 15 to 16,000 extra deaths that happened in the north that shouldn't have happened if the government had really taken levelling up seriously before the pandemic. We can show lots of different outcomes. So people in the north, particularly in the northwest, were typically younger when they were dying. As a result, the north has lost more years of life than other parts of the country. But then crucially and critically, the hospital activity in the north was also more dominated by COVID patients. And that meant that there was a huge displacement of routine care. So essentially, the Northwest had some of the highest cancellations of elective admissions, emergency admissions and outpatient appointments from 2019 into 2020. And this is important because these need to be caught up. And this isn't the fault of the hospital trusts in the Northwest. This is basically because of what was happening on the ground. And again, this is linked very heavily to government funding of healthcare, but also government funding of preventative health measures as well. So these appointments are going to need to be caught up. So there's going to be even more pressure building on hospitals and doctors within Manchester than there is in the other part of the country. So without urgent action, this problem is just going to get bigger and bigger and bigger. So we really, really do need to act, try and tackle this now. We all live through this. We all know that people in the north, particularly in Greater Manchester, were exposed to lockdowns for much longer. And they spent about a month and a half under the most restrictive tiers more than people live in the rest of the country. So we couldn't see our friends, our family, we couldn't do the things that we would become used to doing. And that obviously was going to have effects on our mental health. And that's exactly what the data shows us. So people in the north of England, and again, particularly in Greater Manchester, were much more likely to see an increase in mental health related conditions because of the loneliness brought about by lockdowns, but also the fear of the pandemic and other factors. It wasn't just health that was adversely affected in the north of England. So people in the north were much more likely to lose their jobs due to the pandemic and the lockdown measures. And the unemployment rates were really, really higher, much higher in the north, particularly the northeast and the northwest, than they were in, for example, parts of the south and the southwest of England. On average, people who were lucky to keep their job actually saw their wages slightly decrease between 2019 and 2020. And again, that is really unprecedented. For wages to fall between consecutive calendar years has never really happened before. The rest of the country was relatively flat, but there was a gradual increase. But this fall in the north was really the only place where these falls sort of happened. And we considered lots of different outcomes, so how lonely people felt, whether people were likely to be put on the furlough scheme, how many hours people worked if they did keep their job, what happened to people who lost their jobs, did they need to claim universal credit or other benefits, what happened to prescription of medication we know is used to help people with early onset of mental health conditions. And essentially all of these were worse in the north than they were in the south. So people in the north has got it so bad and everything just compounded. Every possible outcome we looked at was worse in the north than it was in the south. And it really isn't anyone in the north's fault. It's not the choices we are making. As I said earlier, it's a consistent and sustained lack of funding in the areas where there really is a need for this funding to be sent to. One positive we did find is that people in the north are more likely to have had the vaccines, and that is really a positive thing. So it shows that up north we're quite proud and we're happy to help our friends, our colleagues, our neighbours. And without this, these inequalities could have been even bigger. These outcomes in the north could have been even worse. And some of my colleagues, including Caroline Sanders and Ruth Watkinson, have done a lot of great work on the inequalities in vaccine uptake, particularly even within Greater Manchester. So who was more likely to have the vaccine and who wasn't, and why? What was it about this? And obviously there's nothing stigmatizing about people's choice about vaccine. They're trying to do some great work about trying to unpick some of that. So the report made a series of recommendations, but I think people like yourselves are really key to this. We need an integrated approach where we combine the community voluntary sector with local government, national governments, and us as academics where helpful to really come together to tackle these causes of these widening inequalities. But I think if we don't do anything, unfortunately, going to continue to get worse and get worse. But obviously, funding is so important. The community and voluntary sector needs funding, local governments need funding from national governments. So we need to get some sort of proportionate universalism where resources are being directed to the places where they are most needed. And unfortunately, that is areas within the north and particularly certain parts of Greater Manchester. So I will stop there. I'm very happy if you would like to chat to me afterwards. My email address will be distributable later. I hope you enjoy the rest of the day, and I hope there are some positive actions to come out of this in the future. Goodbye.